You know, sometimes a single building, a single idea can completely change the fate of a region. That's exactly what we're talking about today. We're diving into the story of the Suleman Roshan Medical College and how it became more than just a school. It became an absolute lifeline for the heartland of Sindh.
So here's the big question, right? How do you actually bring modern, life-saving medicine to a place that feels, well, forgotten? It's a huge challenge, something communities all over the world struggle with. But the story of this college, SRMC, gives us a pretty incredible answer. It shows that it's not just about bricks and mortar. It's about building a future. It's about building hope.
Okay, so to really get why this college is so important, we have to go back to the beginning. We need to understand the problem they were trying to solve. And let me tell you, it was a big one, a massive healthcare void in Sindh that was just begging for a revolution.
I want you to just picture this for a second. Imagine someone you love is having a medical emergency. Now imagine the nearest specialized care, the kind you really need, is a 3, maybe even 4-hour drive away. For people in towns like Shahadadpur and Sangar, that was their reality, a grueling trip to Karachi or Hyderabad. And we all know, when it comes to medicine, hours aren't just hours. They can literally be the difference between life and death.
And we're not talking about a tiny village here. This massive gap in healthcare, it affected a population of around 2 million people. That is a huge number. 2 million people living in this rural and semi-urban area with no major private medical college, no easy access to the kind of care we often take for granted.
So when you have a problem that big, you need a solution that's just as bold. This is where the story gets really good. It's about one person's vision, one man's incredible goal to step in and completely close that healthcare gap.
And that visionary was Dr. Muhammad Ali Razani. He was a doctor, he was a philanthropist, and he saw what was happening in the Sangar district. He saw the need. And his idea was frankly audacious. He didn't just want to build a clinic, he envisioned a world-class medical hub, right in the heart of one of the most underserved parts of the country. Now, where do you build something this important? The location he chose, Tando Adam, was an absolute game changer. This wasn't just some random plot of land. It was a major railway and commercial hub. Placing the college there made it accessible to all those little rural towns around it. It was positioned perfectly to serve the very heartland of Sindh that needed it most. Just a brilliant strategic move.
All right, so you've got the vision, you've got the perfect spot. What's next? You have to build it. And this part of the story is all about turning that huge dream into reality. Taking an empty piece of land and step by step, building what they now call a medical city.
And check out how fast this happened. They broke ground in 2012. Just 1 year later, in 2013, they get official recognition to start teaching 100 students a year. By 2014, the first class is walking through the doors. And they didn't stop there. By 2018, they're ISO certified for quality, and in 2021, they add a cutting-edge neonatal ICU. I mean, that is incredible progress in under a decade.
Okay, let's talk about the beating heart of this whole operation, the teaching hospital. This is the engine room, really. It's where they're training the next generation of doctors, but it's also where they are, right now, saving lives and transforming the health of the entire community.
And this isn't some small clinic. We're talking about a 500-bed multi-specialty hospital. Think about that number, 500 beds. Each one of those is a new chance, a new hope for someone in that region, a chance for care that was completely out of reach just a few years ago.
And this is where it really hits home. Look at these services: neurosurgery, cardiology, pediatrics. Before this hospital, getting this kind of care meant that terrifying 4-hour journey. Now, it's right there. Add to that a 24/7 emergency room, surgical theaters, even a dialysis center. These aren't just conveniences. They are lifesavers, brought right to the community's doorstep.
The impact went way beyond just medicine, though. It created this amazing ripple effect. Check this out. It created over 1,000 jobs for local people. That's a huge economic boost. And here's the other fascinating part. Because good healthcare was suddenly available, people started using it. There was a 15% jump in people seeking out care. That tells you they were finally getting the help they needed when they needed it, not just when things got desperate.
You see, there are really two sides to the SRMC mission. It's like two sides of the same coin. On one side, you have the immediate need, treating sick people today. But on the other, equally important side, is the long-term goal, training the doctors who will keep this community healthy for generations to come.
And I love this quote from the principal, Dr. Atta Mohammed Chandio. He says, "The true essence of medicine lies in blending science with compassion." That just says it all, doesn't it? They're not just creating medical technicians, they're training doctors who understand that the human touch, that compassion, is just as important as the science.
So what does that training look like? Well, for the students, it's a journey. You start with the basics, right? Anatomy, physiology, the building blocks. But you're not stuck in a classroom for long. You're quickly doing hands-on clinical rotations right there in that 500-bed hospital. And what's really cool is they get you out into the community, working on real-world health projects in rural Sindh. So by the time you get to your final internship, you've already seen it all.
And it's not just about doctors either. Look at this. They're building the entire healthcare team. Of course, you have the MBBS for doctors, but they also have programs for physical therapists, for nutritionists, and for paramedics. You know, the first people on the scene in an emergency. They're creating a whole ecosystem of care, making sure every piece of the puzzle is in place. So, we've seen the problem, the vision, and the execution. Now let's pull back and look at the big picture. What is the real, lasting legacy of SRMC? It's not an exaggeration to say it has transformed a town, a region, and in many ways the nation.
I mean, just look at the town of Tando Adam. Before, it was known for agriculture and commerce, a solid, hardworking town. But after SRMC, its entire identity has been redefined. It's now a beacon, a thriving hub of education and advanced healthcare that people from all over the region look to. That is a fundamental shift. And you can see that legacy in so many ways. For one, the really critical numbers like maternal and infant mortality rates have actually dropped in the district. That's incredible. They're graduates, they're working in top hospitals all over Pakistan and even internationally. But maybe most importantly, they're creating doctors from these areas who are more likely to stay and serve their own people. Oh, and being listed in the World Directory of Medical Schools, that's just the cherry on top, proof of their world-class standards.
So it all comes down to this one last thought. What is the true measure of a place like this? Is it the number of beds or the number of graduates? I don't think so. I think the real legacy is measured in the things you can't always count. It's in the ambulance rides that are now just minutes instead of hours. It's in the new jobs and the local pride. And most of all, it's in the thousands of lives that are now healthier, safer, and filled with more potential than ever before. Pretty amazing stuff. Thanks for joining me on this one.